are still some basic things that all babies need, no matter what part of the world they're in, no matter what their ethnicity or skin pigmentation. And one of them is, access to well-trained doctors and nurses and access to the basics of equipment, of which pulse oximetry, heart rate monitoring, that is fundamental. So when we put these products on a baby's skin, and some of our babies are as low as 500-600 grams, just over a pound in size. Not only are we dealing with infants that have extreme prematurity but variable skin pigmentation, also challenges of anemia and challenges of poor perfusion, and all of these factors can play together. And what quickly emerges is, in other products, we just don't get a good signal. We don't get an oximetry reading, or if we get it, it seems quite disparate with the reality of what we're actually experiencing. So you've got a crowded room, you've got a baby who's bundled because they're premature, you have a nurse and that is not enough for the babies, and you have parents who aren't watching their babies or necessarily informed if the baby's acting abnormal, what to do. So that baby stops breathing. The first thing you would notice, but you don't because of the bundling, is that the chest wall is not moving. Then you're going to notice that the oxygen level starts to drop. And then you'll notice that the heart rate starts to drop, at which point the nurse needs to stimulate the baby, or else she needs to, they need to figure out, why is this baby having apnea? But all of this circles back to Nanan and your monitors. If I didn't have a monitor, this baby could be suffering from recurrent apnea, recurrent desaturations. And if I didn't have accurate pulse oximetry, I would not know that. Furthermore, if the baby's getting sick or septic, they're going to act the same way. If the baby needs more caffeine to drive respirations, they're going to act the same way. If they're tiring out because they're not getting enough respiratory support, they're going to act the same way. In every instance, their oxygen levels are going to start drifting downward. And you don't know that unless you have the baby on a monitor. So a monitor enables us to quickly recognize something's wrong with the baby. And if provided that it's not a equipment error, like the lead came off of the foot when the baby was moving, it allows us to troubleshoot and figure out, do we need more respiratory support, more medication for apnea prematurity, namely caffeine? Do we need to start antibiotics because this baby's getting septic? Is the baby becoming anemic and we're just not getting a good signal and we need to do a blood transfusion? One of the reasons why our survival rates in our NICU is 93% of all of our premature babies, and in most government hospitals, it's about 20%. So we're at 93% survival, government hospitals 20%, is because we have really good nurses and doctors, and we have every baby on a monitor. I think first, healthcare providers need to become aware if disparities do exist, because most healthcare providers probably don't know that is a reality. If they put a child on a pulse oximeter by fingertip, or if they do it on, by a sensor put on the forehead or the hand or foot, they may not know that there's variable accuracies between manufacturers, brands, and where these products are being produced. They may not know that there's a lot of aftermarket products that are also making entrance into the market that are not as accurate as they purport to be. So the first thing is, I think healthcare providers need to become aware of it. And once they're aware of it, if their patient base is a skin pigmentation that is non-Caucasian, and there has been problems with accuracy, then they need to speak up or support a manufacturer who can show hard data on it. Most of those procurement decisions, however, are made outside the control of an average doctor or nurse. It comes through management and procurement lines, and that's where, they need to be willing to speak up about that.